practice, in my eyes, had changed quite a bit in the last several years as far as not being able to do house calls anymore, patient time constraints as far as shortening appointments. And so I was frustrated in that aspect and wanted to be able to have more time with my patients and not be on a time clock per se. Being able to see the patient every day you're here, which is nice to me. See their outcome the next day. You can meet with their family, and give these patients a good quality of life for what's expected. And so it's nice to give them some dignity with what they want. We'll have a better idea then as well. We'll follow up that straight.
It's not just the medical answer that's right. You have to look for what the patient wants. Sometimes the most invasive surgery might not be the best for them because there's a lot of painful rehab that comes after it. So you have to take a good look at the patient and what they want, like what their goals are. How much it goes beyond the patient too. There's a lot of interactions with families and helping them deal with what could be one of the most stressful situations they've ever faced.
My mom is a person, who deserves just as much medical care as anybody else out in the system. She's a person with feelings, with heart. There are so many people here that I've met at the nursing home who are people, and they are so vulnerable, and it is our obligation to take care of our most vulnerable. I would like to see more people attending or being, seeing that, being responsible or being responsive to the elderly's needs, to my mom's needs.
And I think the fact is that we need to somehow get back that we're dealing with humans here, people with lives and pain and weaknesses and strengths, and instead of chemistries and mechanics, and we got to deal with less with those things, those computers, and more with interaction with people and their feelings and their strengths.
The relationships that it looked like the staff had with one another and that the staff had with patients, and the intimacy that nursing home medicine offers for the family as a whole was really intriguing and attractive to me.
And if you were taking care of them to begin with, they didn't do very well going to the hospital. And that's the whole point of trying to decide that they do better if we take care of them here.
Go!
But everyone with dementia didn't always have dementia. They had a life and a career and a family. So you get to know their stories from just pictures on the wall or their family telling you about who they were or what they cared about.
Letting people know what that person's legacy was, even if they're not living it out right now in this part of their life, they can still be honored. Even the way that staff introduce them in some ways is, this is so-and-so who has spent their life doing this.
There's still some of that person left. Like, they may not be able to talk to you or have a conversation, but they're still there. And you can see that, like, when their children come and visit you and talk, and the children are so focused on finding that part of their parent that's still there. If painting their nails makes them feel happy, then that'll give them a little bit of joy. And I think that's an emotion that can still transcend people, even if they have some pretty serious dementia going on.
There's a need, but I'd have to challenge them on the other hand. What do you want to do as a physician? Do you want to really make a difference in somebody's life? Or do you want to crank as many people through your office as you possibly can, give them maybe what they need in the form of their medicines and their surgeries and the like? But I see this as a place for a person who wants to make a real difference in the latter years of somebody's existence.
Or you want to make a difference in people's lives, in their family's life as well. So, I mean, a lot of patients here, it's end of life, and to me, that's obviously one of the most important things that they're going to go through in their families. So,
bring the humanity back to these people. We've got an aging population that needs our care, our attention, our compassion.